Go. Maggie Date.
Hello, Carla.
Welcome.
Thank you very much.
Thanks for making the time to chat. You are another professional art therapist.
Yes, I am.
Yeah. Can you tell us where you work?
I work in a few different places. I have my own private business and I see clients here at my house. I also contract out. So at the moment, I'm contracting out to Maroondah Hospital inpatient psychiatry, and I do group art therapy sessions there, on hold for COVID, of course. I also work for Wyndham Arts Therapies and work with NDIS children and adolescents there. And in my private practice, I work with children, adolescents, young adults and adults.
Yeah. Right, okay. So a few different settings. And clearly the Maroondah Hospital is a very public health service.
Indeed.
Yeah, great. And so you mentioned the people that you work with already. Yeah, did you want to tell us anything more about them?
So my background is in nursing at the Royal Children's Hospital, and that's where I discovered the amazing work of creativity and how it connects and engages, and how kids and adults can interact. It really stood out for me. So now when I work with children, I notice that they engage usually fairly easily and they respond really well to the art processes that I offer. I'm trauma-informed, I'm attachment theory informed, I'm relationally informed. So I like to meet them where they are and work from there. I like to invite them into the play. I like to invite them to make their own choices and then meet them, validate them and hear them. And I find I witness the most amazing changes, especially in children, and it happens often quite quickly, where they've been quite shut down and they'll come alive. Or there'll be those kids that have experienced domestic violence and trauma and will build, but I'll still see amazing changes from in that they come out of themselves and into the world. But they also, I see their neurobiology settling down so that then they can go back to their classroom and not melt down as often. I find it really powerful work, really inviting work. I find all my clients relate to it really well. And so that's why I'm supporting this movement to get things to change, because it's such a wonderful healing modality. And it assists people to do the work without having to always talk about the work. They don't have to talk about their story. And kids, of course, don't want to talk about their story. That's the last thing I find they want to do. They don't relate on that level, but they do relate on a creative, meeting me level. And that's where I find the changes. And so often my heart swells with joy as I see them developing in front of my eyes. So that's why I do the work, and that's why I support this, and that's why I'd like to see our profession grow and be recognised for the wonderful work we do.
Well, thanks, Maggie. I think you've answered nearly every question that I wanted to ask you.
I get excited. It excites me that we are able to help people in so many ways that are available to art therapists. Yeah.
I think that what you've highlighted actually is that in some instances, I mean, what we're asking for is to have our profession recognised alongside psychology and occupational therapy and mental health nursing. But there are times when an art therapist might actually even be more appropriate to work with a young person.
Correct. Yeah, everyone's different and everyone's going to engage differently. So for some people, the psychologist is perfect. For some people, the OT is perfect. For some people, it's the social worker. And for many people, as we're discovering, it's the art therapist, because it gives them choices about how they want to interact. And it's a physical modality where there is a physical movement, whether it be writing poetry or visual arts or just making mess or play or dance. There's an embodiment to it, and I find that really helps. Yeah.
And I was just having a look at the 2019 Royal Commission into Victoria's mental health this afternoon, and noticed it was really highlighted that for real mental health reform, we really need to listen to people who are experiencing mental health issues and their carers and their families. And from my perspective, the fact that so many people who have NDIS funding are using it to see arts therapists, I guess indicates the choices that people will make when they actually do have a choice.
Correct. Absolutely. And it's wonderful to have that choice, because we're all different. We all have different needs, and we all resonate with things in our own unique way. So to have the choice is just amazing.
And I guess choice is always a really big part of trauma-informed practice.
Correct.
Yeah.
Yeah.
Thanks so much, Maggie, for your time.
My pleasure, Carla.
Always a delight to see you, and thanks for supporting this particular campaign.
My pleasure.
And
likewise, lovely to see you and everyone else. Bye.
Thanks.